Friends, welcome back to our channel Let's Crack OPSC, and I hope you have already watched our first part of health science and try to use it, make it notes in your particular notebook, because whatever we will be teaching you have to keep a note of all this, because this is going to be very helpful in your prelim revision time. The more you revise, the better you remember and the better you will able to tackle the MCQs. By the way, I have already declared that we will be making, and shortly we will be producing you the crash course for prelims 2021. It is going to be very helpful, and I am giving you 100% guarantee that if you will follow our crash course and all the videos as well as the things that we will provide in the crash course plus help kit, it is going to be helpful for you. You can easily crack the OPSC prelims, and we will be continuing our discussion in our the continuation of vitamins. Vitamin B1. Vitamin B1 is known as thiamine. If somebody asks you, they may be matching the columns. They can tell you to match the columns. They will give you some vitamins chemical name. They will give you the vitamin, and you have to match the columns. They can ask you in this format also. So be very attentive to all the classes that we are doing. So vitamin B1 is known as thiamine. If thiamine, which vitamin is thiamine means B1. B1 is what is chemical name, then thiamine. Then what are the sources? Sources are rice bran, then wheat, oatmeal, eggs, meat, liver. Liver means goat liver as well as the chicken liver. You have to write that this is the vitamin B1. Then what are the functions of vitamin B1? Major component of coenzyme carboxylase required for carbohydrates and amino acid metabolism. Very important. What is the function of vitamin B1? It is major component of carboxylase required for carbohydrates and amino acid metabolism. Which vitamin is responsible for amino acid metabolism? You have to write vitamin B1. B1 is responsible for amino acid metabolism. Then the deficiency of vitamin B1 will cause to beriberi, then loss of appetite and vigor, constipation, weak heartbeat, muscle atrophy, and even paralysis. Very important. What are the diseases which will be caused if there is a deficiency of vitamin B1 in the human body? It is beriberi, then loss of appetite and vigor, constipation, then weak heartbeat, means those people who are having weak heartbeat, then muscle atrophy and even paralysis. These are very important. Then coming to vitamin B2. B2 is known as riboflavin. The chemical name of vitamin B2 is riboflavin. If they will ask you riboflavin is which vitamin, then answer is B2. Then cheese, then eggs, tomatoes, green vegetables, liver, meat, cereals. These are the items which are abundant having vitamin B2. Vitamin B2, cheese, eggs, tomatoes, green vegetables, liver, meat and cereals. Then what are the things? Combines with phosphoric acid to form coenzyme. Fat essential for oxidative metabolism. It combines phosphoric acid to form coenzyme. Fat essential for oxidative metabolism. It is very much helpful for oxidative metabolism. Challosis, that is challosis. Challosis is what? The fissures on corners of your mouth. You might have seen some people are having fissures in the mouth. That is the deficiency of vitamin B2. Then digestive disorder, burning sensation in the skin. Some people might be feeling there is a burning sensation. Then skin and eyes, headaches, mental depression, scaly dermatitis, then keratitis of cornea, Then glossitis, inflammation of tongue. Some people might be having inflammation. There is some inflammation of tongue. Then that is also the region of deficiency of vitamin B2. Then cornea, keratitis of cornea. Keratitis of cornea. Cornea is present in eyes. Then glossitis. Glossitis is also inflammation of tongue. That is called headache. Some people will be having headache, as well as mental problems. That is mental depression. That is also the problems of deficiency of vitamin B2. Then coming to vitamin B3, it is called as nicotinic acid or niacin. The chemical name is nicotinic acid. 3 is nicotinic. Then B2 is riboflavin. Then what are the things available? That is liver, cereals, fresh meat, milk, pulses and fish. These are the items which are very much essential for vitamin B3. Then what are the functions of vitamin B3? That is active group, coenzyme nicotinamide, adenine, then dinucleotide required for oxidative metabolism. Oxidative metabolism is very important. Oxidative metabolism is requires this vitamin B3. Then active group in coenzyme nicotinic adenine. Then what are the diseases which might be which might happen if there is a deficiency of vitamin B3? That is pellagra, then muscle atrophy, nervousness, headaches, fatigue and mental depression. Pellagra, deficiency of vitamin B3. Muscle atrophy, again vitamin B3. Nervousness, some people are having nervous breakdown, that is also vitamin B3 deficiency. Then headache, fatigue, some people are feeling fatigue, that is also vitamin B3. Mental depression, again vitamin B3. Then vitamin B5. Vitamin B5 is what? It is called as pantothenic acid. The chemical name of vitamin B5 is pantothenic acid. Then milk, liver, kidney, sugarcane, eggs, groundnuts and tomatoes. What are the abundant sources of vitamin B5? It is milk, liver, kidney, sugarcane, eggs, groundnuts and tomatoes. These are very much essential for having vitamin B5. What is the important function of vitamin B5? Required for oxidative metabolism. It requires for oxidative metabolism. Then what are the deficiencies it will cause? If there is a deficiency of vitamin B5, then gastrointestinal disorders. There will be gastrointestinal disorders which might happen if there is a deficiency of vitamin B5. Then anemia. Anemia is another disease which might be caused due to deficiency of vitamin B5. Then reduced secretion of steroid hormones. There will be reduced secretion of steroid hormones. Some steroid hormones which will be reduced because of this hormone, this vitamin deficiency. Burning feet syndrome. There is burning feet syndrome is very important. Then again fatigue. Again vitamin B5. Nausea. Fatty liver in man. Fatty liver in man. These are the diseases which will be caused due to deficiency of vitamin B5. Now moving in the next part, we will discuss next. Now moving to this part of discussion, that is vitamin B6. B6 is known as, chemical name is pyridoxine. If somebody asks you what is the chemical name of B6, it is pyridoxine. Then sources: cereal, fish, meat, synthesized by intestinal bacteria. Then these are the items which is there in the vitamin B6. That is cereal, fish, meat, synthesized by intestinal bacteria. They may ask you a question that which of this vitamin is synthesized by intestinal bacteria. You have to write it vitamin B6. Then what is the function of B6? Coenzyme required in protein and amino acid metabolism. This is the coenzyme which is required for protein and amino acid metabolism. It is very much essential for amino acid metabolism. Then what is the deficiency? If there is a deficiency in your body about vitamin B6, then what will happen? Dermatitis, anemia, convulsions, then nausea, vomiting, mental disorders. Dermatitis related to skin, anemia related to your blood, your then iron and then convulsion, then nausea, then vomiting and mental disorder. It is related to vitamin B6. Then vitamin B12. Vitamin B12 is known as cyanocobalamin. The chemical name of vitamin B12 is cyanocobalamin. Then milk, fish, egg, meat synthesized by intestinal bacteria. Milk, fish, then eggs, meat synthesized by again intestinal bacteria. Vitamin B12 required for chromosome duplication and formation of blood corpuscle. It is very much required for chromosome duplication and formation of blood corpuscle. When the blood corpuscle happen, it requires vitamin B12. So very important, vitamin B12. Then retarded growth, then pernicious anemia due to production of hemoglobin free mature RBCs as a result of deficient intrinsic factor. This is the deficiency. What will happen if there is a deficiency of vitamin B12? Retard growth. It will retard the growth. Then pernicious anemia due to production of hemoglobin. Pernicious anemia will happen then due to production of hemoglobin free mature RBCs as a result of deficient intrinsic factor. There is a deficiency of intrinsic factors. Then vitamin C, that is very important. Vitamin C is the chemical name is ascorbic acid. What is the chemical name of vitamin C? It is ascorbic acid. Very important. They have asked this particular question many a times. Then citrus fruits, tomatoes, green vegetables, pepper, potatoes. Which are the primary sources of vitamin C? That is citrus fruit, tomatoes, then green vegetables, then pepper and potatoes. There was a question in 2019 prelim regarding which among of it is having the highest source of vitamin C. There was a confusion among the students whether it is orange or guava. Remember, guava is having the per unit highest vitamin C. Very important. It is asked in 2019 prelims, OPSC prelims. Collagen. What is the function of vitamin C? Collagen formation, bones, cartilage, teeth, RBCs, connective tissue, and iron metabolism. Fe means iron metabolism. Collagen formation, then bones, cartilage, teeth, RBCs, connective tissue, and iron metabolism. What is, if there is a deficiency of vitamin C, what will happen? Scurvy. It is also known as sailor's disease. Sailor's disease, wounded healing. If there is a wound, it is very difficult to heal. That is very important for vitamin C. If you will intake vitamin C, your wounds will heal very quick and fast. Then growth retardation. Then there is a retardation of growth. If the kids are not being given vitamin C, then retardation of growth. Breakdown of immune deficiency system. Our immune system. If we will take enough sufficient vitamin C, then our immune system will be boosted. Then gums and bleeding gums. Deficiency system, gums and bleeding. When you might have seen some people are having bleeding gums, it is because of deficiency of vitamin C. Then vitamin H. Vitamin H is known as biotin. Biotin is the chemical name of vitamin H. Which are the primary sources of vitamin H? That is yeast, vegetable, fruits, wheat, eggs, chocolate. Very important. This is yeast, vegetable, fruits, wheat, eggs and chocolate. These are very important and sources of vitamin H. Then essential for lipid synthesis and energy production. Groundnut synthesis, synthesized by essential bacteria. It is essential for lipid synthesis. Vitamin H is essential for lipid. Remember, very important, they may ask you a question. Energy production, groundnut synthesized by intestinal bacteria. Vitamin H is also synthesized by intestinal bacteria. Then the last one is the deficiency. The skin lesions, loss of appetite, weakness, hair fall, anorexia. These are the diseases which will happen if there is a deficiency of vitamin H. Skin lesions, loss of appetite, means you will not be feeling hungry. Then weakness, there is a weakness in the body, again vitamin H. Then hair fall, if there is a hair fall, you can see the hair fall, it is because of vitamin H deficiency. Then anorexia is also there. Then coming to folic acid group, it's a folic acid vitamin. It's a group which is very important, folic acid group. What are the primary sources of vitamin folic acid? It is soybean, kidneys, yeast, green vegetable, liver, synthesized by intestinal bacteria. Again, the sources of the folic acid group is soybean, kidney of goat as well as chicken. Then yeast, green vegetable, liver, again chicken and goat. Then synthesized by intestinal bacteria. It is also synthesized by intestinal bacteria. Essential for synthesis of DNA and maturation of blood corpuscles. Vitamin folic acid group which are very much essential for synthesis of DNA synthesis. It's very important, and maturation of blood corpuscles. It helps in maturation of blood corpuscles. And if there is a constant deficiency of folic acid, then what is the disease which will be called? Megaloblastoanemia. Megaloblastoanemia is a low hemoglobin content. Megaloblastoanemia is very important. It is the deficiency of the folic acid group. The folic acid group, megaloblastoanemia. So with this, we come to the second part of discussion of the part 2 of health science. Hope you like this particular video. Then do give me a thumbs up, do spread with your friends, and try to make a note of all of the things we are discussing. These are very important. It will help you in your prelim preparation. You can constantly revise in a short duration so that you do not forget all of this. And for all of you, we have a motivational channel which I will give that in the description. Do subscribe our motivation channel as well as share with your friends as well as relative and friends, because we are giving practical motivation. We are not saying you do this, do that, means only giving a particular thing, but we are giving action plan, how you should be thinking, because in your personality development it is going to be judged. You are going for a particular interview, they require your personality to be up to the mark of an officer, and you can only achieve that particular thing when you will keep on putting in effort, daily effort to achieve that particular height of personality. And that we are helping you by providing our motivational videos. Do subscribe our motivational channel as well as spread it among your friends and relatives. Whosoever wants to achieve something, they have to subscribe this particular motivational channel. I will give that in description. Thank you very much for watching. Keep on studying well. You will definitely crack. Thank you very much.